Thanks a lot, Meenal, for joining us on a big festival for all of us. And so happy to have you here. So let me introduce Meenal, who is not only a very dear friend of mine, but a healthcare expert in her own right. In fact, someone who I have learned from over and over again. She is the founder and director of Craft and Consults, but a career expert in healthcare. She has worked with J&J for what, like 10 years, I guess,
Yes.
across the world. And she is from the prestigious Asian Institute of Management, a brilliant civil engineer, and a very, very dear friend, and a keen observer and researcher in the healthcare industry. Craftlands have been doing, if I know correctly, better business in healthcare than KPMG these days. And I'm so proud of
Oh,
Meena
no.
for that.
I,
So,
I am flattered and honored, Sabine.
so thank you so much, Meena, for coming on.
Always a pleasure to
Um,
be speaking to you and
yeah.
connecting up and speaking about the issues that are relevant and make sense for the country as a whole. End of the day, you want impact.
Because we have over and on and off talked about healthcare in such detail. We have had this, and you specifically have worked with so many different entities across verticals, be it IOs like mine, WHO or United Nations, or companies or universities. To understand healthcare systems, what are your thoughts about health tech innovation affecting service delivery in health?
So I think it's frankly going to make a major impact. And when I today speak to multiple organizations, there is excitement. There is excitement of how impact can actually happen at the real grassroots levels. And we just finished a project in the Northeast, 4 different states, and we see the impact of health tech on management of supply chains. So you're able to predict based on data that's available what products have been used, not used, which we find applicability in terms of what I want to supply to the region at the lowest level, minimizing stockouts and issues of expiries. So that's one impact I'm seeing today. Another impact that I'm seeing is drone delivery. So we've been tracking drones for the past 2 years now.
Wow, okay.
And it's finally coming through.
Oh, really? Okay.
That's finally
No,
coming.
I just saw World Economic Forum do these drone delivery pilots in Northeast for emergency healthcare systems for medicine and blood. And I think, Fly Zipline and others have pioneered some of these use cases across the world. But it's amazing the way, technology developed and how we are now finding use cases in the healthcare systems, both supply and otherwise, and how things are moving in that direction.
Absolutely. Another area, Dr. Sabine, that I see is excitement about hub and spoke. With 5G coming in, just a couple of days back, we were sitting at this Indian pharma company, which has already set up as part of the CSR about 5 to 6 onco hub and spokes.
Okay.
Where onco centers are now going to basic districts with connectivity to experts. And
Right.
that's also what's getting enabled through technology. And when we speak hub and spoke, onco is one area that I'm talking about. Reaching to immunos are very few. Is another area, and there are multiple such areas that can be looked at.
Makes sense.
And after many years, I'm seeing the excitement, but what is really required is data, end of the
Hmm.
day. uh, you know
Yeah, so good that you said that. I have learned so much from you about data portability, and it's been, a sort of passion of mine as well. I really wanted to understand. We have been discussing this for a couple of years now, since blockchain became a mainstream solution. But do you think personal health data, ethical monetization of personal health data, do you think that's possible? If so, how do you see that happening anytime?
so I didn't get your question. Could you repeat?
No, I meant we have been talking about data for some time
Right.
now, and especially what I'm talking about has been on and off discussed since blockchain became sort of a mainstream solution
Right.
in data security. Do you think monetization of personal health data ethically, uh, do you think that is possible
It
anytime
is.
soon?
It
And
is.
how?
It is. So we are actually we ourselves are working on one solution like that.
Right.
Um,
Okay.
but
Tell me more, please.
um, so it's bridging on confidentiality right now. But
Okay.
let me tell you the impact that we see is
Mm-hmm.
um, MNCs coming into India, and if you see, many MNCs are moving out of India with their innovator molecules.
Mm-hmm.
But if they find pockets, and they by law have to provide access.
Right.
So how this data is helping is through prevalence studies,
Mm-hmm. Okay.
so that their access programs can be managed. They can have very specific access programs. Uh,
Mm-hmm.
Rare diseases. Uh, uh, this this anonymized patient data
Mm-hmm.
helps in figuring out, is there an opportunity for a rare disease drug in the
Mm-hmm.
country.
Right.
Um, so I see applications, and I see many more, but today I can't talk about it. Maybe a quarter
Oh,
down. Um,
yeah, maybe someday soon. But, I would love to understand, do you think we will someday soon be able to pass on some of these advantages to people whose data it is in the first place? We have.
Absolutely, absolutely. So patient centric care
Mhm.
is what we're all gunning for, right?
Yeah.
And this is your data, and you should be able to take that call. And again, we are working on a platform like that.
Yeah. See, I'm going to I'm going to take equity in that one, Meena. For sure, that's going to happen.
So we are super excited about it, Sabine, and we'll talk about it when we meet.
Of course, we'll definitely do that. But before that, I really wanted to understand, the kind of value addition that's happening in devices through technology. Say devices in pharma. You are a career pharma person, and then I think that's one of
I
the
worked
bedrocks of.
across
No,
pharma,
career,
OTC, med
pharma device,
devices.
and that's been a bedrock of your consulting work as well. Uh, so, would love to understand how some of these newer technologies is changing as you mentioned, I'm sure you have a couple more examples. How is it value adding some of these delivery systems, some of these developments, some of these product understanding? How is it changing? How is the market changing per se?
I see it what we spoke about. If I have one word for it, it's
Mhm.
actually gradually going towards patient centric care.
Right.
Everything that we see happening is gonna, I see ending up at patient
Mm-hmm.
centric care. Of course, the journey has been up and down.
Mm-hmm.
Some years back, there was a lot of excitement about IoT.
Mm-hmm.
As a matter of fact, 6 years back, My husband was the one who set up IoT, was part of the team that set up IoT for IBM in India. And I pulled
Hmm.
him out because I saw the opportunity, and then there was disillusionment because
Hmm.
you think of technologies, and then when you come to implementation, you figure
Hmm.
out that the operating models
Hmm.
don't really support. The technology might be great, but
Hmm.
the operating models that you have in place don't support adoption of those technologies.
Hmm.
And with now, and I think what's needed to get to that patient-centric care is there are people who are working on multiple things in bits and pockets. It
Right.
is standardization of what I'm working on so that there's interoperability. The
Hmm.
um, the challenge of operating models becoming so expensive because you want data to talk to each other, or any other thing. For IoT, the biggest challenge we face was because the devices, most of them were imported.
Hmm.
Uh, but uh, there has to be a balance, frankly.
No, I completely agree. IoT has had its times and then not. And, now we have so much more coming in the market in terms of technology. And sometimes I struggle, both to understand what's coming in and also to make sure you have use cases. One of the larger challenges for me was NFTs, maybe except one or two interesting use cases, I've never really been able to understand how to make that, into a use case per se.
Mm.
So what are your thoughts, right?
So
Do you think that's,
frankly, I think there's a long way to address still the core, which is automation and digitization.
yeah,
All of this is dependent on, and I'm coming back to garbage in, garbage out.
okay.
So unless I have the core system in place where I have the records, I have digitization, and Dr. Sabine, you and I have been talking about digitization for the longest time now.
I know. I have been eating your ears out on it, haven't I? Very much.
All this will work if we
Right.
have the right inputs. Your
Yeah.
AI, whatever. But but you see things taking shape.
Hmm.
It is we should be proud of ourselves to say that we have all our COVID vaccines are digitized, which
Hmm.
even the US doesn't have.
Right. No, I mean, it's very true. The way Southeast Asian markets, and you have worked in many of them, have developed on the basis of technical adoption is beautiful. I mean, the last I was in the US, I really thought they were falling behind in terms of technical adoption.
Exactly.
It was really surprising to a certain extent because I too, and the kind of speed of adoption we see in this part of the world is amazing. I think we are at a place where we were talking about leapfrogging. I think we are in the in the process to leapfrog. um I think we are in
5G
a,
excites me. Another thing we need to be aware of, and I've seen that very closely, for any technology adoption, again,
Mhm.
is a balance between, and we've done multiple projects on that in terms of the impact on livelihoods.
Mhm.
It may take the job of someone else.
Right.
So, as a
But,
matter of fact, we did a 2-year project with US FDA
mhm.
because they wanted to ban certain things. It
Okay.
took us 2 years to figure out who it impacts, the impact, and not just the impact on livelihoods in the country, but
Mhm.
globally what countries it impacts.
Right.
So again, that balance.
Hmm. No, I think uh, because you said so, I wanted to understand how do you think coming technology will impact public health, and I mean rural public health, and because you mentioned access earlier as well. access to, we all know the three A's, the problem statements of healthcare, right? Access, accuracy, and affordability. And public health becomes one of the crucial areas for application of all of these solutions in that space. So, and because you said about job shifting, and there are people for whom upskilling or uptraining is not always an option. So, yeah, and that affects most in some of these rural areas for whom this is a primary or the only source of income sometimes. So, how do you see that falling into place, both the technology and its outcomes, and its outcomes on the job markets
I
otherwise?
don't have a good answer for you right now because each
Mm-hmm.
space is different.
Mm-hmm.
Um, when what we've also seen is when we go to the grassroots, there are challenges of getting to the right person itself.
Mm-hmm.
Forget job losses.
Mm-hmm.
Technology we see impacting, having a very big impact there.
Mm-hmm.
Moving care to community level, especially for NCDs, and that's how we met. Was
Mm-hmm. I remember.
crucial. One crazy project that was.
Yeah.
But
I'm still trying to figure out Meena till date where you got my contact from.
but I'm glad I did. I'm
I
really
was so
glad I
glad too. I wanted to go thank that person, but yeah, no.
Yeah, that's how it is. Some things I think are meant to be.
Yeah, I meant true. But yeah. So you were saying about your rural welfare project.
Yeah, so like I said, I don't have a good answer for you in terms of the impact on livelihoods,
Mm-hmm.
because each piece has to be seen separately. Like I said, that
Right.
one piece was 2 years of impact
Mhm.
across the value chain, and
Mhm.
there's not one straight answer.
Right. And I'm going to ask you something that you're going to kill me for because it is so obvious. But please, because I know it's not obvious for everyone, tell me the difference between predictive analytics and AI in healthcare. I knew that.
I don't know.
No, come on.
I don't know how they fit into each other. I really don't know how they fit into each other because I still I'm yet, frankly, to see the impact of AI. Hello?
Yeah, please continue. I'm right
Yeah.
here.
So I'm yet to see. I hear a lot of AI. We are working on a lot of AI. Um, Predictive analytics, still seen some kind of output. AI, I'm still clueless about. Frankly, I talk a lot about AI, but between you and me, I don't know.
No, I also know very little, I must admit, but I think what we are doing today is largely predictive analytics. Right?
Yes,
We haven't really reached the AI stage yet. We haven't
that's
really
exactly what I was referring to. That predictive,
the
I've still
diagnostic
seen
engine.
the impact. AI
Mhm.
is its goal, but
Not
I guess some
there yet.
technology guy is going to be able
Mhm.
to explain it better.
So
Uh,
then next I'm going to get Harun on board for that. For sure.
actually, but
So
from a
yeah, Arun, by
business
the way, is
perspective,
a very well accomplished consultant and Meena's husband, and hence a good friend now. So, and a lovely, lovely person. I also wanted to know, I wanted to kind of discuss because you worked in so many spaces and looked at problem statements, looked at solutions in such depth. I wanted to know what are the bottlenecks that you see? One of the technologies that we have seen around telemedicine. What are the bottlenecks do you envision in telemedicine per se?
so the biggest bottleneck I have seen was infrastructure of connectivity. Um, because about 5 years back, uh, we tried to set up health ATMs
Mhm.
in rural
Those
areas, which,
kiosks.
yes, those kiosks. Um, And when we went deep down, and those kiosks also, so you had telemedicine where you could consult through those kiosks, as well as dispensing of medication that could have happened. But it never went beyond POC, across beyond POC across couple of states, because of the major issue of connectivity, and that's why 5G excites me.
Mm. You know, what I feel is that there's another thing also. Telemedicine generally depends on the availability and quality of the knowledge of the doctor, right? So even if we do develop the technology and infrastructure, that is still going to be a bottleneck because we are never going to be able to churn out enough number of doctors. I'm not saying
Hmm.
good doctors. I'm sure we do have these very good doctors out there, but their their time is such a limited equity that we are not able to equitably divide it across both the segments, tele and physical. So I think there I feel there is a huge bottleneck for scaling up such solutions per se.
So, it's an interesting point that you bring up. My father-in-law retired as the Director General of Armed Force Medical,
Mm.
and the year he retired, is like, let's open a medical college
Yeah.
because I see a need for more doctors. And I got two raps in my head. It's like, is it the quantity which is less, or is it the quality which is less? So, what I understood of that discussion is,
Mhm.
um, there are too many
Yeah.
in the centers that you don't require,
Yeah.
and too few where uh, and too few in many other areas. So
Right.
it's actually the distribution,
Mhm.
which is a challenge right now. And over the years, when I see at least the private medical colleges going empty, uh,
Mm.
despite having seats, uh,
Yeah.
kind of reinforces the rap that I got in my head, that
Yeah.
it's getting the right care to somebody who's beyond our metro, mini metros, T1 towns. And I'm
Mhm.
glad to see that now care is reaching T2 post COVID. That's one good thing I see of COVID.
Yeah.
Uh,
No,
in a
honestly,
place
I
where
mean,
they don't require
I
very
think we
more
have spoken about this too. That COVID, of course, was the worst thing that has happened in my lifetime, and I've
people.
seen some things. But the thing is that one very thin silver lining that has come out of it is that finally people are listening to people like us, man. People never used to.
True that, true that, true that. But also, what I also realized in that NCD project, Sabine, is that many things, if tackled at grassroots in the proper way, actually
Mm.
don't require that specialized care.
Yeah, no, that makes
Uh,
complete sense. We really need to start from these grassroots applications of solutions. And on that note, I wanted to touch a bit with to EMR. We have been talking on and on and on about EMR and data, and I think we touched upon the fact that we don't really have data availability for good AI, the kind of long span outcome data that we require. And then there is, of course, the whole insurance bit that comes into it as well. But what are your thoughts about how EMR is progressing not just in India, but in the entire Southeast Asia? Interportability of some of these systems, because now globalization has hit another gear.
right.
Everything is global, everything is portable. So, what do you see about health records in the Southeast Asian systems?
I see, ever since it has started moving to cloud,
Mm.
uh, I see far more adoption.
Yeah.
And we have invested in one such system, which is also at T4. because cost of acquisition, Sabine, becomes low. So it's become affordable. It's become a mandate. It's become affordable. But the challenge that I see is because it's affordable, uh, somebody's moved to this new data system,
Mhm.
was in an old data system, refuses to, even if the vendor says, I can give you seamless transfer, is not happening. So what gets lost is longitudinal data.
Mhm.
Um,
So I think, and going forward, I remember this is one of the major hospitals in Bombay where I saw people taking printouts from MRI machines and then rushing it to the radiologist who then checks and then scans them back to create the EMRs. On ground, though the technology exists, the actual adoption of it has been a problem in generating data collection from multi sources. I think that I feel has been a challenge. Also, now I think with ABBA, it's going to
yeah.
be better, I believe. But even with that, like up until now, at least, if you are going to create a new EMR every time you go to a healthcare system, so there is no way to connect those.
And that's what brings me back to a point that I mentioned earlier. It's different people
Mm.
working on different technologies,
Mm.
and then how do you make them talk to each other?
Yeah, exactly my point. So, on that note, I also wanted to talk about a little bit on data privacy. There is a lot of talk now with the whole EAMS situation happening in India and the Aadhaar data system and all of these let's say catastrophes happening in the data privacy space. Do you really see new technologies now taking over, maybe blockchain technology taking over, or other things in terms of sustainable long-term solutions towards data or network security?
Yes, absolutely. And a very dear friend actually handles security for one of the biggest telcos. And I've been having conversations with him in terms of what partnerships they are having. And looks like we're going to have a stronger
Mm-hmm.
system.
Mm-hmm.
Again, going back to, I don't know how the operating model will look like, and it may just become it may not be feasible. Uh, but I have personally seen at least him working with multiple stakeholders,
Mm-hmm.
bring out solutions which will take security to a next level.
Mm-hmm. I think that is going to be crucial going forward. And one of the key ways to not just use data to monetize personal healthcare systems, but also look at insurance. So I really wanted to just touch a little bit on the insurtech side of it because you and I have spoken in detail about that, and I know you are keenly interested. How do you see in the coming couple of years insurtech really evolving in the Southeast Asian market? Because we are some of the least insured areas, even though we have structured healthcare systems.
Like I said last time, I don't know.
Mm,
It's exciting, but what value it brings and how
mm,
many we bring in is uh, I still have to
yeah.
seriously see, because at least value based healthcare, although exciting, I have
Mm,
not seen much adoption. Uh,
right.
so uh, I'm still, as an outsider watching, would like it to be there, but reserving my thoughts.
No, makes sense. No, I completely understand where you're coming from. We really need to try and make PBIS systems viable going forward, maybe with the whole wearable market and continuous monitoring systems kicking in with such flair and uh, at the cost that they are right now, probably sooner rather than later, that might become a viable way to go about. So
Correct.
fingers crossed, I will.
What's exciting is, at least our generation, um, we weren't so much risk takers. The new generation is excited working on technologies,
Yeah.
and we see so many new things coming in from them.
Yeah.
So I'm sure it's going to be faster than ever.
No, I completely. I mean, the other day, we were talking about 3D printing and ovary. I mean, you read about that, right? 3D printing a freaking ovary. It was pretty amazing. I mean, now that we are going to a phase where tissue implants and others are so, xenographs used to be the kind of things that were innovative when we were around, when we were still in our education systems. Today, I think that is moved to another gear, to another level. So I think exciting times ahead, let's say that, for
Yeah, I'm
health.
also privy to some of the technology companies globally on
Mm,
the research that they're doing.
mm,
And if even 1% of that comes out and is successful,
mm.
I see multiple landscapes changing.
Um, no, no, I completely understand. And one of these days, we'll do a post NDA discussion. No, but it is pretty fascinating the way health and technology are marrying into each other to provide value to the end patient. I think that is crucial, and that is what we are going towards. So
True that, true that.
I think good times ahead. And thank you so much, Meenal, for joining on Makar Sankranti and Uttarayan. And
Always a pleasure to be chatting up with you.
pleasure is very, very much all mine. Thank you so much for
All
joining,
right.
and best of luck for all your projects.
Thank
And
you
see
so
you soon.
much. Bye.
Bye bye.